Thank you very much, everyone, for joining us on a Tuesday Melbourne evening. For those of you that have participated in some of the sessions from Melbourne Connect already, well done, congratulations. There's been some great cross speakers, and they've done a really, really good job of bringing people together that we really wanted this to happen face to face, but to be frank, for what we're doing, we can almost do that. We can actually reach more people virtually at the same time. So well done for Melbourne Connect for being nothing if not nimble in these environments. And today we've got a pretty, for those of you who know that the way Aging 2 works is we always try to have an international flavor as well as 2 local flavors in regards to startups doing things actually in the region. And I'm pleased today to basically welcome Stephen sharing what's going on in the global community with Aging 2, and then we're going to jump in with Jessica Kinnear from Compare Villages, who will wave now somewhere if the camera is on, and we'll then also hear it from Mandy Solomon from Dementia, doing great work. And what I'd love to also do is we have Kyall Walker basically talking through the way innovation and next steps works in the sector. This will actually be an active thing for you to do as well. After we have our formal sessions, we're basically going to pull together a little bit of a, not a work, it's not really work, it's basically, we'll be sending you on a little worksheet. You'll be pushed off into little rooms. The feedback from people is that you want to spend more time in smaller groups together, discussing and or coming up with solutions for the challenges that are in the sector. So after the formal presentation, there will be a time for you to actually break off into smaller groups of probably 5 or 6 per group. And we'll send you off in your own little breakout room. There'll be no note taking. You don't need to take notes for this one. We're going to push you off into a separate area where you can basically, we're asking you to spend some virtual money and actually come up with a solution, how you'd spend money in the care sector. But we'll talk a little bit about that later. But without ado, I'd like to introduce you to Stephen Johnston, who will unmute his microphone, of course, at this stage, and we'll take you through in the next sort of 5 minutes about what's going on in the global chapters of Aging 2 and some of the reports that have been coming out.
Awesome. Thank you, Mark. Feel free to yell, do feedback if you can't hear me or you can't understand my weird British isms. Lovely to see everybody. Good to have over 50 on the call so far. Great. And thanks again for Melbourne for the Connect team. Innovation Week is really exciting. I'm excited to be part of it, and sorry to be here in Melbourne. My background, just very briefly, is from the UK, working on Aging 2 for the last 10 years now, and happened to be here for the last 18 months, and happy coincidence, ended up moving here, and partly due to the pandemic. And so we're working here at Aging 2 Melbourne, and Mark has been doing a great job of driving the local chapter, but we really have a global perspective. Some of you will have heard me give a few over comments about the global network before. I'll just take about 10 minutes to sort of reintroduce what we're doing, but then also want to spend most of that time talking about I think quite an interesting initiative that we've put together with Stanford University around family caregiving. That was a project that we did the last few weeks that we still haven't shared publicly, but I wanted to just sort of give a heads up to this group of some of the insights and the learnings that we're seeing, because I think they resonate both obviously in the US market where we did it, but also in the here in Australia. So I think what I'll do is just share a few slides. And as I said before, if you do get the chance, feel free to just sort of throw comments down in, as I said, it's nice to introduce yourself briefly, but then just sort of throw comments into the chat in terms of stuff that you think is interesting or relevant or novel, or things you haven't sort of seen before, or you just don't make sense, or you want to follow up, or if you see other people that you think are interesting to chat with, do please share. So great. So just very quickly, recap on the Aging 2 global network. 130 cities now around the world, run by volunteers. So this is really a very bottom-up, boots on the ground initiative. The way that we essentially are creating this network in order to solve these grand challenges. And it's very much a combination of topics that come up from our chapters, but then also our corporate partners who are interested in things that they see and that are relevant. So it's just an example of some of the recent events. As you see, those pictures were taken before COVID, and so we've been shifting from in-person events to virtual events, which, as Marc said in the intro, is actually works pretty well because we can really get a broader perspective and plug in experts around the world. And our mission with Aging 2.0 is to really accelerate global innovation in aging and longevity. And so much of that is about hearing what's happening in other parts of the world and then sharing perspectives. And we're lucky enough to have some corporate partners who are sort of taking the top-down perspective, what's happening around the world. And often what we do is scouting, workshops, insights around certain topics, certain themes. Just a selection of the active ones we've got there now around sort of healthy aging and family caregiving, two of the most active. But also elevating care is one we've got running in Toronto, Canada-based Amica, senior care provider, which affects, I think, is a global question about solving the care shortage and trying to sort of basically understand how to improve care innovation and remove the challenges that we'd be having around staff shortages. So just a quick sort of glimpse then in terms of this particular project that we worked on recently, which I'm really excited about in terms of the way we are identifying common themes and challenges with innovators to address the needs of family caregivers. So this was a project that we did together with Stanford University Distinguished Career Institute, and this is a sort of longer version, which we'll be sharing in public shortly. But I'll just sort of give an overview commentary, which was how do we support the innovators and the startups who are themselves supporting the family caregivers? And so we did this as a project under the collective. And the approach that we're taking is some insight to action approach. We start off by understanding the problem from the perspective of those who are working at it in a very sort of design-centric approach, then progressively moving to the right-hand side. I won't go into too much detail into the data. I'll be familiar with many of those working in the space, but just sort of highlight some of the issues that came up, focused again on in the US, and this is not necessarily true to every country, but I think it's quite relevant to many countries. Where a comment that we liked was sort of the caregiving startups are essentially creating these ornaments for Christmas trees that don't exist. So we've got the lack of a system. We got the lots of sort of really good ideas, a lot of startups delivering interesting value, but there's a lack of structure, a lack of systematic. This lack of sort of systematic activities in place to make the system work. And the US, as I say, in particular, was particularly relevant here. But I think there's a lot of overlaps that we've got, especially here in Australia, as we're thinking about, our whole aged care system and care in the home in particular, and how sort of we essentially operate and cope with people living longer lives. So we've got a bunch of startups in the room, and then asked them all beforehand, did sort of interviews about the topics that they were finding that were challenging their efforts to grow their startups. And we put these into 8 different domains: distribution, channel, health systems design, market awareness, market maturity, policy, funding, product mix, and staffing, and got a real sense of the kinds of things that they've been battling against. And as we at Aging 2 and our sort of partners are thinking about how do we make the system more effective, these are sort of the ways that we can start to, topics that we can start to work on. We did a small survey, and one of the things I'd love to do is to work with partners who are interested in the topic and do the same in Australia, but in a much broader sense. So we did, with the startups, we sort of asked, what are the challenges that are most relevant for you? And missing impact metrics was one of the ones that came out the highest. Difficulties of identifying caregivers, and then the fact that family caregivers are not part of the healthcare teams sort of featured the highest in terms of things that we can do to improve, to help the startups and innovators improve their prospects and of being successful in their variety of different ventures. So I won't go into too much detail, but I suspect that some of the startups on the call will recognize some of these quotes in terms of brutal cost of trying to go direct to consumer. Basically, this is sort of the lack of a Christmas tree, the lack of a direct to consumer channel for delivering products into products and services into the hands of consumers, especially consumers who are stressed, who are busy, who may not be as technically sophisticated, and frankly got their hands full. Fragmented channels, the lack of integration of healthcare, family caregivers into healthcare teams, misaligned incentives. This is probably more specific around the US market, when there's pretty much more of a focus on the commercial side of things. I obviously I've spent a lot of amount of my time going up in the UK, but then spent quite a bit of time in Europe, and then 12 years in the US, and so now a couple of years in Australia. So it's experiencing different kinds of healthcare systems and incentives. And the universal sort of truth is that pretty much all the countries that I've got experience with, very few incentivize healthy aging. And this idea of actually, can we financially support people to live longer and healthier, really isn't in the lexicon of the many who operate in the sort of healthcare system and the medical industrial complex, which is by definition based on people getting sick and being paid to cure the sick people. So it's just a mindset that I think a lot of this, and I won't go into too much detail, in terms of, you sort of get a sense that these are very specific topics that have been brought up. Longevity insurance was one of the ones that Japan and Germany are doing this, I think, quite well, relatively speaking, in terms of funding it. In the US, it's a particular challenge. I don't know what the situation is here in Australia, but I'd love to learn more about what that looks like. And talent is the last thing. And then we put this sort of the system summary together here with the topics that we have identified. And then the last 2 minutes, this is obviously just a bit of a blitz, but I just wanted to tee up and sow the seeds of a couple of the thinking, the sort of ideas that we then started to build on, based on the work that we've been doing here and in the sort of results of those insights. Then we put together a set of recommendations around actually what we think could happen, and sort of the innovation opportunity areas that look like. And so this is just the last couple of slides I'll share. And essentially what we did is we created a sort of startup success systems map, if you like. Well, it's probably a better word for it, but essentially what we said is taking all these different perspectives into, taking a sort of step back holistically. What do we think we need to make the caregiving innovation sort of system work better? And we ended up with these 4 collaborative project ideas. First, I'll go to the next slide, which just finds a bit more carefully. Defining caregiving. Who is a caregiver? What does it take to be a caregiver? What are the kind of tasks that are needed that are common across different types of caregiving? Essentially, the sort of taxonomy and definitions. Connected to that is measuring impact. How do you measure what good caregiving looks like? What are the metrics of success? And which different stakeholders are interested in assessing startups in particular on different success metrics? Because we were finding that some of the caregiving startups were focused on, for example, selling into employers, and they had to have different metrics around cost reduction and reducing days off for their workers, whereas others were selling into health plans, Medicare, Medicaid, which was more around, again, cost savings, but different types of measuring cost savings, for example, reduced hospital readmissions and things like that. And frankly, there's almost no B2C success stories that we were able to find. And that's really why most of the companies that we saw, a lot of them started with B2C and then pivoted away from a direct-to-consumer model because they just found it too expensive to scale up. And then sort of essentially that's the sort of summary of the key ideas for each one. We fleshed out a bit more background, and then we started to put who are the kind of companies that we want in the room to be able to have the next set of conversations. So I'll sort of leave it here in terms of we're teeing up these sort of 4 thematic topics around defining caregiving, measuring impact, open aging standards. So sort of essentially, can we learn from the banking system where, especially in Europe, they are doing open banking where you can share your banking information and your secure details more easily with others who might have access to your, who you want to give access to your banking information, but you can't really do that in health. And there's all sorts of people on here who will learn a lot more about the Australian health system and records than I do, but I think this is a universal problem. I know there's been some discussion in that in the Royal Commission. And then the last one around fixing the B2C, and for there we had a couple of quite specific ideas around longevity insurance as a one product concept, paying for people to live longer independently and allowing them to have products and services to keep them independent, which is sort of a different type of product than the long-term care product, which is much more about paying for long-term care and chronic and acute services. And then a solutions marketplace, which was this idea of actually building a B2C matchmaking model so that consumers can access their innovations more effectively. So apologies for the sort of rather short summary there, and just to give a glimpse of the kind of topics. I'm excited to get on with the rest of the conversation, but if you're interested in this topic, you want to be engaged in something similar in Australia or have ideas, then just ping me, Stephen at Aging2, or connect with Marc, and we'll be doing something like this across Australia in our Aging2 chapters so far. Here in Melbourne, we're just really revamping this one, getting excited to sort of have a more productive program. Sydney, Adelaide, and Brisbane are our sort of chapters right now, and hoping to really get more of these activities off the ground. So with that, Marc, back to you.
Thank you. And one of the great things, and I say this every meeting we have, having done multiple meetups and startups in Melbourne, is most of the things you think you are unique on, you're not. There is somebody somewhere on the planet that's already put some thought process into that, and vice versa. So with Aging2, one of the big things here is not to work on things necessarily in isolation. Don't be smart individually. A lot of these problems are being addressed by very large global players. The interoperability, the standards, defining care. What we want to do is make sure we have an Australian voice to that. We want to make sure that what you're working on in Australia is the Australian context and the Australian voice around those worldwide problems, because that's the good thing. The challenges are global. And that's why Aging2 really exists, is to make sure that we do stuff local, and then we basically tap into the global. So we'll always have Stephen, and we're lucky to have Stephen here as the founder of Aging2 globally. With the, one of the silver linings of the COVID cloud was, having your family and everything here with you, which is a good thing. And what I'd like to do now is direct ourselves to two, let's call them local companies, Australian companies doing great work. So we'll spend about 6 or 7 minutes with each one of those. And I'd like to introduce you to sort of Jessica Kinnear from Compare Villages. And one of the interesting things about Jessica, if you want to unmute your microphone, and if there's anything you want to share, let us know, is that Jessica is also not necessarily from the aging industry, but is doing great work in that sector from a legal background and doing great things. For those of you that haven't heard of Compare Villages, I'll let Jessica quickly tell you about what it is, but from a retirement village perspective. So Jessica, welcome. The stage is yours for the next 6 to 8 minutes.
Thank you. Thank you so much for having me. So I'm Jessica Kinnear, as you been told, and I'm the founder and CEO of Compare Villages, which I launched a few years ago now. It's really based on a very sort of simple idea, really, to solve a problem to do with transparency around the retirement village sector, and in particular the contracts. So my background is as a sort of an expert lawyer in the space, having worked both in private practice and for one of the largest operators in Australia, which is Lend-Lease. I worked in-house there for many years. And one of the problems that I came across, having sort of worked as a lawyer in particular, and even just sort of having that perception, talking to people out in the community, is really a lack of understanding about retirement living. And one of the common sort of public misconceptions is that retirement villages and aged care facilities are one and the same, whereas they're actually quite a separate offering. And retirement living is really about offering, you know, an independent living community for senior people, you know, who want to sort of move into a sort of a safe community with facilities and services available, you know, with the sort of a sense of security and safety that provides. So Compare Villages is Australia's only website that comprehensively compares both lifestyle features, so things that somebody might be looking for, you know, to do with, you know, whether or not there's a pool or a bowling green, you know, through to what services they might provide, you know, meals, cleaning, that sort of thing. And then also on the flip side, which no other website is really featuring, which is to do with what fees are charged. So there's a big pain point for operators is, you know, and a sort of a negative view that many people have of the industry, that they are fee gouging, you know, customers, and sort of a lack of understanding to do with the financial model. And I think a lot of that has to do with a lack of transparency. So this was really, you know, an idea to sort of solve a problem as a win-win for both the industry, who I think are doing really great things for people, you know, offering a really great service, and also the consumer who's looking to make an informed decision. So I'll share my screen quickly. I'll just sort of show you, you know, the comparison. Hang on, sorry. So this is just an example of comparing. So this is actually a Lend-Lease village, but Lend-Lease has 3 different contract options available, and you know, we compare the entry fees, so from the entry price, as well as ongoing fees. So that's sort of fees that are paid, you know, like a service fee payable for services while the resident is living in the village. We compare any exit fees charged when the resident leaves, and we also have a departure entitlement calculator, which gives the user an estimate of what they're entitled to receive when they leave. So that's also unique about the platform. I'll just stop sharing. But you know, this, to sort of focus on the why, you know, it really came about due to you know, frustration from people, and providing a service to help people make an informed decision. The experience has been, so we're sort of reliant on operators being, you know, providing us that information to feature on the platform. And we found that the larger, well, mostly the larger operators are quite willing to do that. Some are not. And so we are sort of looking at sort of potentially pivoting a little bit. So focusing on also the offline services we can provide. So that's legal advice, which is my background, and some changes to the website to sort of coincide with that. So coming back to really sort of looking at what the customer needs, putting the customer sort of front and center, and the focus has been initially on the online platform, but now we're sort of looking at actually you know, the fuller sort of offline service that we can provide, you know, the hand holding from sort of when somebody leaves their family home through to, you know, moving into a village, is sort of what we're looking at. And as part of that, I guess we're sort of becoming, or will become, the customer or the consumer's representative, and we'd be kind of looking to obtain this information on a sort of you know, per request basis potentially. So, you know, so we could kind of overcome some of those difficulties of operators providing information up front, which is what our current model requires, that we would get it on a sort of on a per request basis, based on us essentially being the representative for the consumer in a legal capacity. I think a lot of the issues around you know, the fact that this is sort of new, and you know, you can't sort of readily access this information, is that I think there's still a little bit of not putting ourselves in the consumer's shoes. I think we younger people, you know, find it difficult to sort of think of themselves as aging, and there's a little bit of an us and them kind of thinking. And, you know, I think the traditional selling model for the industry to residents has been to sort of focus on the sort of glossy brochures and selling that kind of lifestyle without sort of properly educating them on, you know, what the sort of financial side of things is. And our consumers are far more sophisticated. You know, the boomers are the fastest growing user group of technology, and have greater expectations about being able to research, you know, significant life choices online, and that's what this this service was really about, sort of plugging that gap and solving a problem.
Cool.
That's me. Have I gone on?
No, you're wonderful. Thank you. One of the really interesting things about the service that you actually provide was the data insight and the analytics, and we'll cover that off a little bit in Q&A. But the data that you can give about the search terms, who's coming from where and what's actually going on, is the analytics that's happened in the advertising industry for a long, long time. But actually being able, one of the stats that sticks in my mind when you spoke earlier at a previous function was that, you know, the number one search, I think, for like care homes in Victoria was like from Queensland. So there were Queensland older residents looking for facilities, retirement villages in Melbourne, like in Torquay or something. And knowing that 20% of the search was coming in that direction allowed them to go, oh, well, we actually didn't know that, because we thought it was Victorians going up to Queensland, or those challenging those assumptions. So it'd be great around the data in the Q&A, maybe perhaps to sort of expand a little bit on that as well, with your permission, because that was certainly something that resonated with the audience around the data that you were generating in retirement versus aged in community care, and what that actually looks like as the feeder. So without further ado, thank you so much, Jessica. Without further ado, I'd like to also introduce Mandy Solomon from Dementia. If you could unmute your microphone, I'd love, and Dementia is one of those great applications of someone who's absolutely passionate around a topic, and then seeing a gap in the market and being personally touched by that, and actually not just doing a little bit something, not just starting up, but actually forming a whole ecosystem and a company around solving that problem. So Mandy, you have 6 to 8 minutes, and more than please tell us your startup story in this space.
Okay, well, let's just test the technology. Are you seeing my slide? My PowerPoint slide?
Not yet. You just hit the share button.
Sorry, everyone. Your time starts now. Let me just hit the share button. Share. Okay, I'm almost there. You're
done. We're good. We can see.
Yeah, but you can't see my presenter view, can you? How's that?
There we go. Perfect.
Gorgeous. Okay, thank you, everyone. So I'm Mandy. I'm from Melbourne. I want to tell you a little bit about our company, but particularly about the product that we make, which is called Diva World. And it is a virtual world that is customized specifically for people living with dementia. And this came out of research that I did whilst a PhD student at Swinburne University. And a lot of my research was based around this simple idea of how can you have a digital life when you have dementia? Or to put it another way, how dare we as technologists and designers and thinkers in the aging area dare to presume that just because someone has dementia, they cannot have a digital life. And that speaks, of course, to the emerging, one day everyone with dementia is going to be a digital native. And so it's just laziness was what I was thinking, that has created a scene where digital lives cannot be had by those with cognitive disabilities. And there's a very quick story that I'll tell, which goes to the why, which is that I was doing some ethnographic work for a think tank I was working for at Swinburne around immersive environments and how could that be repurposed for thinking about work, or could the news be told immersively, for example, these sorts of sort of on the edge ideas. And I did some ethnographic work in games worlds, and I met people that had a lot of physical disabilities, and they would say to me things like, memorably one said, I can be more myself in the virtual world than I can in the actual world, because this person had created a persona for themselves that was fully able, fully bodied. There was no stigma in such worlds. They were able to sort of liberate themselves from these body bags that were just pulling them down into a sort of, shallow, small, insular world where they felt stigmatized and misunderstood. So having a virtual persona in an immersive world was really liberating for them. And I started to think, well, physical handicaps can be, people address those things, but what about when you have cognitive handicaps? What can you do in such worlds? And I did a lot of research and found that nobody was doing anything around cognitive disability. And of course, dementia came front of mind, not only for family reasons on my side, but also because of the burgeoning cost of dementia to families, to governments, to society, and it was a need, that there was a need for new solutions. So as I delved more into dementia, I found that one of the cornerstones of living well with dementia is the ability to express who you are. And that's something that doesn't leave us, but when we are unable to have the same tools for expression, then we sink into this abyss of not being able to show selfhood. And that's where a lot of the social problems of having dementia come into focus. So who am I? How can I share that with other people, my lived experience? And so looking at what was on offer in a digital expression of looking after people with dementia were sort of, transitioning well-known games onto an iPad, such as tic-tac-toe. But how does tic-tac-toe or solitaire, or these sorts of swishing the paint with your finger games, what does that tell me about, what does that tell people around me about who I am? And so I thought that if anyone is going to if anybody needs amplification of self, or a system that assists with the amplification of self, it's people who have a shrinking capacity to express selfhood, i.e. people living with dementia. So I looked at the digital lives of most healthy, quote unquote, people, and of course it's Pinterest, it's Facebook, it's YouTube, and it's games like The Sims. And so looking at taking a synthesis of that, I was really looking at how we can create a digital tool that helps to bring some of those sensibilities to people when they have cognitive disabilities. So Diva World is in fact a home, just like The Sims is a home. And it's a place where you can build, where you can share artifacts of lived experience, such as photographs, music. You can change the environment. You can play instruments. You can move around the space and go up the stairs and out into the garden. And it does sort of give this sense of a place. It's not just some place on a space on a screen. It's a place. Everything is situated. I see my stuff. And this became the genesis of the tool which Mentia now makes, Diva World. So I don't want to take too long to express a lot of stuff, but essentially within Diva World, there is a guide, an in-world guide, who we change languages according to the country where it's being used. And so she talks in Greek, in French, in English. There are many elements of pharmacological, non-pharmacological well-being that are built into the world. So they can work in the garden, they can feed the cat, they can listen to the sensory experiences of the garden. There's music to play on the transistor, there's apples to pick, there's birds that you can touch and they react and fly away. You can walk around the garden, and the garden, incidentally, is based on dementia-friendly design. So if you look through the scholarly material on how to design a garden for someone who has dementia, that's the kind of that's the sort of antecedent of how we created our garden. And then we worked collaboratively with people in memory care to see what they could do, how they could respond, etc. The graphic on the right is a first look of a new part of the world, which is an equine experience called Connected Horse. And it is built with what we call a world builder, which is a organization, a therapist, a group, in this case called Connected Horse, who have an equine therapy that they run with people with dementia in California. And that involves physically going out into the barn, mucking around with grooming tools, going into the tack room and looking at the saddle, and then taking the horse called Star out into the walk area, unbridling it, feeding it carrots. There's there's a goat and a dog that yaps. And we really just follow the protocol of Connected Horse. And so this is Connected Horse inside Diva World. And this is a fascinating opportunity, really, because it means that anyone with a therapy can come to us and we can transcribe, or at least take the essence of their work and work collaboratively with them, of course, to develop the same protocols they have in the actual world and scale it within a virtual environment. And then the way Connected Horse works is that when people sit down to do the Connected Horse therapy, they also have sensory boxes which are reminiscent. They have carrots that they can play with, and they can smell the leather, and there are artifacts that respond to the actual world olfactory and touch senses that enhance the therapeutic experience. So
Mandy,
yeah. I'm running out of time.
You are. It's not that we don't. I think the interesting notion, if okay, is the fact that you can bring an animal therapeutic and then basically align that align a digital therapeutic to a non-digital therapeutic in an environment that's familiar to them. So we like it.
And that's just the last slide is just to show you that this is all done with a dashboard for customization. So that provides all kind of data insights, networks, upskilling, etc. And I think this is a critical part of the digital therapeutic, is it has to feed into the wider system that's being used inside the organization. That's it.
It's well done. Thank you, Mandy. And one of the really interesting feedback points from some other research that's happened was that they're in-home exercise, as an example, and the use of avatars. So we do a lot of AR and VR in my daily life. One of the interesting points that came back was in-home exercise with an avatar was far more popular than in-home exercise with a real camera. So especially in the aging population, just like our kids create avatars and virtual versions of themselves, for an older Australian, it was something like 7 times greater uptake when you could create a virtual avatar of yourself exercising in your own home, but that you could still link to your community while you were doing that. So if you wanted to be a pink robot, or you wanted to be a unicorn doing your exercise, whatever it was that was familiar and happy to you, but then still doing that together as a community. So the notion of an avatar, the notion of a digital life, I would think, also doing work in dementia, is that people would assume that that's not a high-tech environment. It's actually the flip side, and that's why, Mandy, the stuff that you're experiencing and that you're getting as well is showing that it actually is a better application of this technology than what you actually think. It's actually better than anything else out there for this particular cohort of people that have these particular situations. So I look very much forward to more data, more results in the Q&A as well. Without further ado, I'd like to throw the microphone open to Stephen and Kyall. Kyall Walker, as a quick introduction, was part of BUPA in the innovation division, and is also more widely known for the aging how do you say aging decelerator?
Accelerator.
That's right. So it's not an accelerator; it's a decelerator in aging. So with it'd be great here to have. So we got Stephen and Kyall having a sort of a fireside chat now. Sort of a one-on-one, more interview style, and then what we'll do after that is we'll get some time for you guys to basically network a little with each other around very, very specific outcomes. So thank you very much, Stephen and Kyall. Take it away.
Cheers.
And I really enjoyed the presentations, and so it'd be great if we could have a sort of time for a bit of Q&A as well, specifically and feedback on the startups, because it's really great that they'd spent the time with us, and always good to hear what people think, and because I'm sure the questions that you guys have are often the ones that we have too. So this session, I'll sort of kick off and say super excited to have Kyall with us. He really, I think, embodies a lot of what Aging 2.0 stands for, and I'm super excited to have got to know him the last really few months of being here. As you will probably remember, the joy of COVID meant that we had to reschedule this from an in-person event. And at the time, I think I was a few pounds lighter and a few years younger and had less grey hairs. And Kyall was also working for BUPA at the head of new ventures and innovation over there, and since left, which I think is even better because now he can talk freely and have more time to play on these interesting new ideas. Really, the sort of meeting of minds, I think, is around, I think we share this common desire to reframe the conversation around aging and longevity away from a fairly narrow perspective that I think a lot of people in public policy in particular in Australia have, which is around aged care and the negative implications of the aging tsunami and all the various different metaphors that have been applied, to actually think differently and taking a step back to go, wow, arguably the biggest human achievement ever is the doubling of life expectancy over the last 100 years. And so we've all been given another 30 years worth of life, and that's fantastic. The challenge is starting to be, I think, a bit more interesting around who gets to enjoy those 30 years or so of extra life or more. And I think the problem is indistinguishable from the bigger challenges we've got in society around economic inequality and the way that we run society. I don't think has been optimal, let's just say that. And I think each country has their own, their own sort of position along the continuum. My experience in the US was living in Silicon Valley and New York for 5 years each. It was a different mindset and perspective on that. And I was in Silicon Valley with a lot of these quite big, bold Silicon Valley venture billionaires who are looking to live for a long time or forever. And I think what we're seeing, and I think Kyall can describe this, is almost like a coming together of this sort of longevity, life extension world and the almost like practical day-to-day quality of life, health span, for those who want to maximize the quality of health for whatever days you have. And I think there have been quite a difference between those two worlds, and I think we're starting to see them come together a little bit with some of the innovations. It's not all just about taking a cool pill and living longer lives. So maybe I'll just start, Kyall, just sort of taking a step back. For a lot of people who think about aging, they think about aged care. But you and I are coming together saying, hey, we're excited about longevity. This is upbeat. This is exciting. This is an opportunity that we can sort of reframe the discussion and introduce longevity economy thinking into Australia. So as you think about longevity, what does that mean to you? And just sort of give us a little bit of background as to some of the things that you're seeing that are so exciting about the current longevity discussions.
Cool. Thanks, Stephen, and well done to all the presenters thus far. It's been very fascinating. So, and I also see my image here versus when my camera's live and realize that I am aging. I feel more rapidly. It's probably not being able to get out and maybe get a haircut and dress for society. So, Yeah, so I guess the way I think about it is really across the human lifespan. Maybe I'm a scientist by trade originally, and sort of moved more out into the healthcare side of things and the science. But I think really there's a point in everyone's life where, you know, your stem cells start depleting, and I guess biologically you're kind of not growing and improving. You're starting to regress slightly, so you're going over the other side of the curve. So I really think about aging as like, from that point onwards, the aging experience has been quite predetermined, and we've had some really fantastic innovations over the decades, such as antibiotics and things like that have really allowed us to extend it. And more recently, technology that should allow us to better support people during their aged years. So yeah, I really think about it across the lifespan, really. I think my objective when I talk about longevity is not about tagging additional years of being unwell right at the end. It's really around increasing that health span, as it's referred to as. And yeah, I think it's ambitious, and we're sort of really bad at forecasting. We often think things are, you know, take longer or too short, but I think it's reasonable to think that by the time we get to our final years, that they may be more around the 100-year mark, such is the maturation of various innovations. So kind of just like, I suppose at a esoteric level, like I think of it as that health span. And I think for me, it's around how do we support people to be as healthy for as long as possible. And Stephen, you've said this one, you know, live long, die short. And I think anyone who's witnessed someone who has aged at the end of their years, it's often a really unpleasant final few. If you have a long life, the end is often can be quite unpleasant and drawn out a little bit, because medicine's got us so far that we can kind of keep people alive, but not necessarily well at the end. So to that point, I suppose to answer the other part of your question, you said like, what do I think is fascinating in the innovation space? So I kind of chunk it down, and this is the thesis for the Aging Decelerator, is supporting teams, supporting early founders, innovating in these areas. So really around like the first one, I guess, is we can't refer to it as like longevity risk. Like, what are the risks associated with you that may predispose you to a certain pathway as you age, good, bad, or indifferent. So, and that, I guess the theme that this is often captured as in health is the quantified self. So this is really around like the genome, the epigenome, the microbiome, like these kind of three themes that really underpin how healthy and well we are, and they all interact with each other as well. So there's certainly been a lot of maturation in that space as that people are starting to be able to get more data on themselves. An example of this, just to give you a couple, like I'll give you three interesting ones that I like. So one, just to come back to kind of the more medical stuff, is Grail. So they kind of came out of Illumina, which is a big biotech. They spun out, and they're just currently in the process of trying to get through the approval process to acquire them. They do liquid biopsy. So they've come at it where they can identify 50 basically stage 0 cancer. So 50 types of cancer just by looking at your blood. So that's fantastic. That's like antibiotics. That's something that we're going to be really good at detecting disease early. And I guess just to come back to another definition for me is a lot of things like cancer, cardiovascular disease, Alzheimer's, like the diseases of aging. Like you can look at a curve and your risk factors, or I guess as you age, the likelihood that you'll experience one of those diseases increases as well. So that's something that's really, it's near, it's close, and it's something that's really going to help extend human life a little bit, because we're going to be able to identify cancer earlier than we currently can today and prevent there. Other ones I like, Veritas, who are doing the whole genome. So think about 23andMe. 23andMe did 1% of your genome. Veritas, for about $600 can do your whole genome and tell you what your risks are. So I think these are the first really interesting things, because they're available for all consumers, all of us, if we have the interest, and just make slightly better decisions. So I actually heard the CEO of Veritas say he recognizes that he has a gene associated with fibrosis in the lungs. So he's like, I can't do anything right now. There's nothing I can take to knock that out, like CRISPR. Again, I try not to get too medical, but CRISPR people have probably heard of as well. Like you can't really take that gene out or replace it. But he says all he does is makes decisions in his day-to-day life about exposing himself to environment. So if he doesn't walk past construction sites. If there's a construction site with lots of cement or lots of dust, he just crosses the road. So they're little things he recognizes. He's genetically predisposed to have scarring in his lungs as a result of that event. So I think that's awesome. I think then the interventions come next. Drug discovery, thanks to AI, is really progressing. Repurposing of drugs, metformin, rapamycin, like there's lots of things that are here now. And then I think just to round out kind of the biotechy stuff is, I guess the things I'm excited about, the inventions are kind of the ones that are near here and will make an impact to our health and our health span. I think because of the process of getting to market faster and cheaper, like nutraceuticals, which are like supplements, and you can get them personalized. So again, if you know yourself a little bit better, you can get personalized supplements. What they'll say is, unlike pharmaceuticals, they haven't gone through clinical trials, but there's enough evidence to suggest, like, there's a product that an Australian scientist in Harvard, David Sinclair, talks about a lot, which is NMN, nicotinamide mononucleotide, resveratrol, spermidine, which is what it sounds like. So if you can wrap your head around that, it's got some longevity benefits to take as a capsule, and yeah, rapamycin. But in terms, so like they're the things that I think about a lot around, like how do you understand yourself, and how do you then use that information to stay healthy and really slow your biological aging process down? Another invention or innovation in that space is actually aging clocks, which are getting quite accurate as well. So they'll actually tell you your biological age rather than the bio age, which is, I guess, not that accurate. And then it's around, I guess the next wave is the interventions, and there are things like nutraceuticals, repurposing drugs that are already available that are known to kind of add or slow your rate of aging by 5%. And then I think the next wave that come is going to be, that magic pill type thing, but and actually starting to reverse and reset some of your biology as it degrades. And then, of course, I guess my focus is probably not to talk as much on the aging support stuff, because I do know we've got other speakers here that are that have talked through that today. But obviously, the Royal Commission into Aging points out we've got a massive issue. Care's not done as well today, but the things that we are investing in and that we're looking in this space are really around home care, because that's what the consumer wants. That's what the customer wants. They want to be at home for longer. So what are the things that are going to allow them to do that? So, remote monitoring, and I know a couple of you on the line today are solving this challenge as well. Remote monitoring allows them to feel safe and secure in the home, and I guess augment the care requirements a little bit as well. I think social isolation is massive. And I know that's been touched on as well. So I really like, and I'm starting to see more and more business models that are looking to support people. And Eldera is one in the US, which is really interesting. And then probably the last one that I'm really fascinated by, and this is something we might touch on if we get time, is like the economics don't really work with an aging population. Like by 2035, the US saying they'll be bankrupt based on the current amount of people that will be paying tax and receiving social support. So there's a whole lot of economic issues coming in the near term. So I think financial support or financial models for people as they age, like how do we introduce the gig economy to people so they don't need to be in a 9-to-5 job 5 days a week, but there's some element of being able to extend their runway a little bit, given they're going to be living longer, but they've been paying superannuation on the assumption that they'll live to, I guess if they've got to the average age of about 84. So sorry, a very long and drawn out answer, but I think for me, like what I want to share is like, I really think about the whole aging experience. And I think about the fact that you've got this, like at the end of life, we're trying to solve a lot of these challenges that are very real and absolutely require solving. But it's kind of like at the same time we're in a leaky boat and we're bucketing out all the water, we've kind of got to start to think about, well, how are we going to slow the rate of water coming in? And I think that's around keeping people healthier.
Yeah, fantastic. Thanks. There's a lot there, Kyall. And I wanted to just dive into the recent paper that David Sinclair, he mentioned, shared with Andrew Scott on the paying or the value of living longer. And I think this is a really, for me, it was a watershed moment when I started to think about it and be more interested in what I otherwise, frankly, had sort of dismissed as these, bearded scientists coming up with all this, which felt also, frankly, quite selfish. And we're not in a particularly good position to, to have people living longer in the climatic, catastrophe that we're in. So, is this really a good idea? And all that kind of thinking. But the paper, it was in Nature a couple of months ago, recommended to have a look at. Basically, was suggesting that if we can help people live an additional year of healthy life, then it'll save or provide $38 trillion of value to the economy, essentially allowing people to live a healthier, be less sick, and be more productive, which I think starts to get at this point that you mentioned about how do we pay for longer lives. And so I was just kind of wondering, is that your thoughts on that, and how do we essentially pay for a society in which people are living longer? And right now, we're not really set up. We see ageism in the workforce and people leaving their jobs and not being able to get other jobs apart from perhaps Uber drivers. How worried are you about our ability to fund longer lives?
Yeah, I think I say it two ways. I'm worried, but I think it's certainly solvable. And I think, I'm a big believer in the human potential, and we're really good at solving things when we collectively focus on them. So I think it comes down to the fact that this paper by Andrew Scott's amazing, because they start to talk about yes, there is a massive downside effect where, as I mentioned before, the US are talking about by 2035 devaluing the US dollar, and governments don't want that because economics is at the heart of government. So that's kind of the downside of it. But if you flip that and say, well, how do we solve the problem and where do we invest the money? I think what they're looking for is a return on investment as well. So the Andrew Scott paper kind of flips it, where it talks about, I think it's $35 million for every, $350 million for every additional year. And so I think actually, you said 35 trillion. So yeah. So I think they start talking about this as, even if it's just chunking it down to that every year, what does that mean? Then I think it probably needs to be looked at through a couple of mechanisms. One is, yes, continue to invest in research and development to try and identify, well, what are the best bets to get us those additional years of healthy life? And I think to your, that's probably around treating it differently. So continue to still invest in our aged population. They deserve it. They're the ones that have really built our economies and societies to afford us the privilege to look at this next wave of challenges. Make sure they're looked after, but also invest in that wave, which is how are we keeping people healthier and wanting to work longer. And what work looks like, I guess, is, that's a broad and interesting question as well. And so, I think yes, governments absolutely need to understand it. I think that's where the billionaires, as much as I think most of them are probably driven by their own ambitions to live longer, it's kind of the only thing money can't really buy is significant life extension. But also I think often they're kind of they've made their money because they've solved a lot of really I guess expensive problems, so that they're up for the challenge. But I think as well, yes, they'll be benefactors of it, but they're spending a lot of their own money and energy, but they're also very influential, money talks. So I think their endeavors are important because it actually does start to get the attention of industries and governments and investors. It drives money in. So I think continue to invest in the research, but I think as well, that question and the society questions, as well as, I guess related to the economic questions, is how do we get that dividend? Is it that a 65-year-old's going to work to 66, 67, 68, 69, 70 because they feel better? Are we ageist because of the way people look. Like, I think that's a really complex problem, and I think it absolutely needs unpacking as well. So it's very broad and it's very difficult. But yeah, I think if I was to chunk it down, just to summarize my own thing, I was going to say at the top, there's no way I'm getting through this without a kid walking in and it's happening. So yeah, it's really that you keep investing in the science so we can understand like what are the things that are going to help, keep investing in finding financial models to support people as they age, and then that continue to invest in people as they are aged.
Awesome, you got a backup. Well, I think it's a perfect time to switch back to Marc. I did have another question which we can think about, which was the sort of the policy side. If you in conversations with some senior government folks, what are we asking for the political side? But I'd rather, Marc, we keep to schedule, and we can all think about what's our ask when we have those conversations, and have a breakout. I'd be really interested in generally what we all think about the topics that we've discussed so far. Thank you.
Thank you.
Well, thank you for sharing. And there is the notion of, it's called aging 2.0, but really the interest of topic is longevity and what does that look like? And the notion that aging is not necessarily something that's sort of done to you. It's not a condition per se. It's something that you actually should be a part of. It's something that you can direct up to a point. And how do you do that in an active way?